Are you struggling to find doctors and specialists who truly understand you and your needs?
Our AAMG doctors are conveniently located in San Francisco and San Mateo County and can provide you with the most attentive service. Medicare's annual enrollment period is approaching. Call 415-590-7416 to learn more about your healthcare services and benefits that you might not have known. That's 415-590-7416. Call today.
So here's some samples of a corn and callus. They are usually at the top of the toes, in between the toes, and beneath the foot, usually at the ball of the foot. It's very important to treat in patients with diabetes, patients on a blood thinner, patients with poor circulation, patients with no feeling in the feet. I'm Dr. Melody Chong, a podiatrist. I treat ankle, foot, and some leg issues. And I'm located at 3838 California Street. And I've been in practice over 25 years. So basically, corns and calluses are a thickening of skin due to pressure and usually over or under a bony prominence, a bone that stands out more, is more prominent basically. But they are usually at the top of the toes, in between the toes, and beneath the foot, usually at the ball of the foot. So the treatment consists usually of changing to different shoes, padding, and removal of the corn and callus. However, I don't recommend the medication that you can apply from the drugstore because those can cause infections. Same with the pads with the medicines. I don't recommend those as well because they can cause infections, especially with people who are diabetic and have poor circulation. The reason I don't recommend them because they often cause more pain, they don't remove the corn or callus, and they can often cause an infection or a hole in the skin underneath the corn or callus. It's very important to treat in patients with diabetes, patients on a blood thinner, patients with poor circulation, patients with no feeling in the feet. The reason again is because you can get an infection or an underlying open wound in the skin. The skin can open up. And often these are confused with warts, which is a virus in the skin. And it's very hard for a patient and even primary care doctors to tell the difference. So I do recommend that you come see me because I can best tell you what it is, whether or not it's a wart or a corn or callus. And so some treatments are just, like I mentioned, basically just removing it. It's very simple. It's usually pain-free. And I recommend this kind of treatment every 2-3 months. And I also recommend applying a non-medicated pad, maybe an insert if they keep coming back. So those are the main treatments. So here's some samples of a corn and callus. Again, a corn is the top of the toe, and it's just thickening of skin. And here it's shown on the foot here. It's a soft buildup of skin. And then a callus is thickening of skin as well, but it's usually on the bottom of the foot. And here's an example of what we call a callus and this is the ball of the foot. So as you can see, there are a lot of very common foot problems, and I've only discussed some very common ones I see in my office. There are many types of treatments, including what we discussed, which are most common, but there are some other treatments available for these conditions. So should you need my care, I can help you, as each person is individual, very unique, and therefore the treatment is customized to you. I can provide successful outcomes so that you can feel better. So just want to let you know, patients and other doctors are very happy with my results and know I provide great care. Patients also refer to me, as do doctors, again, who refer me their patients. Our office is also readily available, so one can schedule in a timely manner. And we're a very welcoming office. Our location is well known, and we welcome new patients. My office is at 3838 California Street in San Francisco. It's adjacent to the old Children's Hospital, so the cross street is Cherry, and our phone number is 415-386-3338 or 415-386-FEET. Do you have a solution for your foot problems? Comment on this video and please let me know. Thank you.